Hey everyone, it's Nurse Dani, and I am here today with Wayne Crawford, PA, Dr. Pool, and Dr. Hayes. And today we are going to talk about what resources are available to you when you or your family are sick. Where do you go? And so we have representation from Connect Care, Kids Care, we're going to learn more about those two, and the ER. So I'm going to give each of you a chance to introduce yourselves, tell everyone a little bit about you, starting with Wayne.
Well, I started a path in medicine many years ago, actually out of high school as an EMT working on an ambulance and in a hospital as a cardiology technician. Got a degree from the University of Utah, Cuyahoga College in Ohio, and an advanced degree out of the University of Nebraska. And have been practicing as a physician assistant in a variety of practice settings, including community health centers, multi-specialty clinics, retail-based medicine, and most recently, Connect Care, the most successful medical project I've ever been involved with.
I'm excited to hear more about that in a minute. We're lucky to have you here at Intermountain. Dr. Pool, tell us a little bit more about yourself.
Yes, I'm Dr. Tami Pool, and I did my medical degree at Tulane University in New Orleans, and then I did my pediatric residency at St. Christopher's Hospital in Philadelphia. I moved out to Utah about 10 years ago, and I initially worked at the University of Utah in the emergency department and the RTU, which is an observation unit, and then transitioned to Kids Care 5 years ago, and I'm now full-time at Kids Care and recently became the Associate Medical Director for Urgent Care overseeing Kids Care.
What a good resource we have in this area. So again, I'm excited to hear more about that too. Dr. Hayes.
Thank you. I'm from Salt Lake City. I went to medical school at the University of Utah and did my residency training in North Carolina, and am happy to be back in Salt Lake. I've been here about 10 years, and I work at primarily at LDS Hospital, Intermountain Medical Center, and Riverton Hospital in the emergency departments. I'm part of a group called Utah Emergency Physicians, and we have a tight partnership with Intermountain Healthcare, and we provide the emergency medicine care in their emergency departments. And I'm currently working as the medical director at LDS Hospital in the ER.
That's great. Well, I hope to never have to meet you as a patient. So while we're talking, if you guys have any questions for our providers, we'll get to some situations in just a minute, kind of run through some scenarios of, common things that families run into every day. What's the appropriate use? Where should we go? But if you guys have questions, start posting them below. And if we have time at the end, we'll get to a few of them. So, Wayne, tell us more about Connect Care for everyone out there who may not have heard about it before or who's heard about it but hasn't used it before.
Connect Care is a fairly new program in Intermountain. It's been here for about 3 years and is currently one of the leaders in the nation for telemedicine. This is a direct-to-patient connection. So you get on your device, about 95% of our patients are coming in on their smartphones, and they download the app for the Intermountain Connect Care, and they go through a very brief registration process, and then they can connect with a provider. And the most common things we see patients for are things like pink eye and sinus infections and rashes and influenza, things to that nature. It's been incredibly well received because primarily you can't beat the convenience factor. I've seen patients completed a visit where the patient's head has never left their pillow. And driving down the road as a passenger in the car from rural Utah, they could be on vacation, traveling within our service area, and it's just incredibly convenient for the majority of patients who participate with Connect Care.
And if there's any wait time, you're at home. Like you said, laying on your pillow, not a big deal. Do you have any data or information about average wait times with Connect Care?
I believe our average wait times are in the neighborhood of 6 minutes. And of course, it's convenient for everybody all at the same time when the kids are going to bed, when you just first get home from work, whatever the situation may be. So occasionally
everyone tends to line up at once.
Exactly. Right. But we do have multiple providers on board. We've got about 12 full-time equivalent providers that rotate through being on duty at any one time. And so multiple providers are available for the patient to select and see. They can choose one that may have patients patients waiting to see them. They can choose somebody that doesn't have patients waiting. It's up to them when they connect.
I myself have used this, and it is very convenient, so everyone should give it a try. Tell everyone about cost.
The cost is $49, and that's basically a flat fee regardless of how much time we take with the patients. And there's, in the registration process, a place for you to put in a valid credit card, and then any insurance information. If we have a contract with that insurance company, it will often cover a lot of the cost of that $49. So as far as the various options throughout the community, it tends to be one of the better values, assuming that it's within our scope of practice and something that we can properly address through Connect Care.
Yeah, definitely. You and I had an interesting discussion before we started about, I asked the question, say I take my family to Disneyland and something happens to one of us and I decide to use Connect Care. There are some caveats to being out of state and using it, right? Clarify that for us.
Yeah, as telemedicine is evolving, the lawyers have determined that the practice of medicine occurs where the patient is geographically located.
So just to clarify, all practitioners are not licensed for each state. That's the hang-up, correct?
Correct.
Okay.
So our current service area, all our providers are licensed for the state of Utah and the state of Idaho. If you are outside of that service area and need to utilize Connect Care, just before you connect, change your address to wherever you happen to be located, and then you can continue to use Connect Care, but it will roll you over into a pool of providers that we have a national contract with that will be licensed in the state where you currently are.
So you can still use the service.
Oh, yes.
That's great. And pharmacy, it's really important to update your pharmacy information rather than just go through that quickly, because you want to make sure that one's in the system that's close to you wherever you're at the time.
Correct. We try to make the whole process really easy. Sometimes it's easy to blast right through that pharmacy page, which is one of the areas where we have a lot of callbacks. If the patient doesn't put in the pharmacy they want to use for that visit, then they have to call back. For instance, I have a firefighter that I've seen a couple of times, and depending upon where he is rotating through as to which pharmacy is closest for him. So he'll update his pharmacy. And if this is after hours, you may want to make sure that it is a pharmacy that is open 24 hours a day. Although it's best to use one pharmacy for all of your medical needs so they can track the medicines that you've used, your allergies and everything else. Sometimes it is more convenient and appropriate to utilize an alternate pharmacy.
Okay. So what else should people know about Connect Care as far as their experience? What should we use Connect Care for? You mentioned a few things like sinus infections, influenza, rashes, pink eye. Above and beyond that, are there any hard lines that we can draw for people when they shouldn't use Connect Care?
That is really a difficult question, as people understand triage or trying to decide where the best level of care is. It is difficult. I think that's one of the underlying reasons we are here today.
Yeah.
But if there's something that obviously would need an in-person evaluation, procedure, labs drawn, something to that nature, it would be appropriate to get into an alternate level of care. We can't do stitches through the computer.
Right.
As much as technology is helping us, we're not there yet.
Yes. And you also mentioned a little bit earlier when we were talking, any infant with a fever, 3 months or less, they should not use Connect Care.
Correct.
Yeah, it may be the most convenient use when you're a mom at home with a baby, but not the best place to call.
We would be happy at any time to listen to what the concerns are and, if appropriate, address it. If not, we'd be glad to utilize our expertise in referring to an alternate level of care.
So, Dr. Pool,
Yes.
that would be a good place for them to go if they had an infant with a fever. Tell us about Kids Care.
So Kids Care has been in existence for about 18 years, and it started initially as an alternative or as an after-hours alternative to going to the emergency department. So when they have a sick child and the pediatrician's office is closed, or if they can't get you in, that's where our role comes in. There are 6 Kids Care throughout the greater Salt Lake Valley. We have one in Bountiful, one in Sugar House, West Jordan, Taylorsville, Altaview and at Southridge, which is next to the Riverton Hospital. All of the facilities are open 4 to 9 p.m. during the week, with the exception of Taylorsville, which is 9 a.m. to 9 p.m. every day. And then on weekends, we have extended hours. So some of the facilities are 9 to 9 and some are noon to 9. And all of that is available on the website.
And let's face it, things tend to happen when pediatricians' offices are closed, just kind of like you were saying.
Absolutely.
So what a great resource. So is there anything else that people should know that's specific to kids care?
So the kids care is staffed by pediatric urgent care doctors. So that's a big bonus for us, is we're all pediatricians. And we're, as you had said too, when people call, and we've had this happen so many times, someone's concerned, and that is exactly why we're there. If you are worried, we want to see your child. So.
But there's something about the gut, and you talked about this a little bit before, Dr. Hayes. Everyone knows what the ER is. They usually are familiar with the closest one to their house, but tell us a little bit more about your perspective as an ER doc.
Yeah, absolutely. The ER is, for everyone, it's going to be part of your life at some point, and we are happy to take care of patients. We take care of anyone 24 hours a day, 365 days a year, and we take pride in providing excellent care. We of course take care of the life-threatening conditions, the heart attacks, the strokes, severe injuries after car crashes, or unfortunately violence that takes place. But there are many things. Emergency departments in general are attached to hospitals, as they are in Intermountain healthcare hospitals, and so we have full resources of MRI, CT scans, general surgery, internal medicine, various subspecialists that we can consult for certain things. And what we've said so far is absolutely true. Triage is sort of the art of deciding how sick a patient is and what kind of resources and what kind of care they'll need. That is evolving. And it came out of the battlefield many, many years ago, trying to decide how do we best take care of people. And we are still investing a lot of time and brain power and research into determining how do we most appropriately care for patients in the right venue and the right order. And it's a work in progress. For parents taking care of kids, you have that personal element where you're not only looking at things objectively, but you're worried about your own child. Mm-hmm. And one thing I have learned, and that I didn't learn in medical school, is that parents in general do a very good job of trusting their gut sense. How sick is my child? How concerned should I be? If you are concerned that your child has something serious going on, bring them to the emergency department. If you think that things are okay and they don't need an in-person evaluation, they may not need labs, that they're relatively stable, then of course take them to what you feel the appropriate venue is. But it's tricky. There is definite overlap between everything we do, and I think that we take care of each other's patients, and we see people in the emergency department who later are seen by Connect Care or their primary physician or an urgent care, and our kids care and Connect Care colleagues send us patients that that need the resources we have in the emergency department. So unfortunately, it's tricky to draw a very clean line between each of these venues, and that's okay. Don't stress about that too much. Yeah. Trust your gut feeling, and we will take care of you. So.
Say that I took my child to the emergency room because I was concerned. We go home and something pops up that doesn't seem emergent, and I just want to ask a question, kind of have someone check what I'm thinking. Would Connect Care be an appropriate use to then call and say, okay, we were seen in the ER, I'm seeing this, or I haven't seen an improvement yet, and to use Connect Care as like a triage door to help me know where to take my child at that point? Is that an appropriate use?
Certainly. We can evaluate whatever the circumstances are, and with the providers that we have on staff and their experience, make some informed clinical decisions and recommendations for you in whatever your particular circumstance is. If you're worried about, you got stitches in the ER and are they infected, or maybe it's starting to open up or a stitch fell out, we'd be glad to look at that and help you through an appropriate decision-making process.
Okay, good to know. You also mentioned something a little bit earlier when we were talking that I think is an interesting point to make. You said that when someone's at home and they're using their smartphone, in most cases, instead of like sitting in an exam room and being this far apart, they're this close when you're seeing them. And so that automatically helps you to get a different perspective on things. Expound on that.
Yeah, the Connect Care is actually a very comfortable medical format for the patients. They're generally more at ease in their home or car or wherever they're calling from, and not going to be quite as reserved with some of the minor points of concern or the history. And we're able to really delve in and get good, deep answers to our questions that help us in our decision-making process. And often, when you're less than an arm's length away from the camera, we're able to really get a good look at not only the body language or whatever's going on in a particular body part that we're looking at. So, yeah, there are some advantages to having that outside of the exam room medical evaluation.
Yeah, no white coat syndrome. That helps a little bit. Okay, so let's walk through a few actual scenarios. I'm going to speak as if I were the mom or the one that has this concern, and then we can kind of talk about where the best place would be to go for it. So let's say that I just found out that I'm pregnant and I'm experiencing vaginal bleeding. Where do I go? Kids care may not be the best resource.
Probably not the best option.
Okay, Dr. Hayes, do you want to take this one?
Yes, absolutely. There are some important considerations for vaginal bleeding in early pregnancy. It can be benign, it can be harmless, and most of the time that is probably the case. But there are also some important things to consider. And it can happen, this can land anywhere on a spectrum. There can be light spotting with really no other symptoms. And if that's the case, it's very appropriate and reasonable to follow up with an OBGYN. We can, of course, evaluate that in the emergency department, but it's not critical to do so. However, if there's significant abdominal pain with this, if there's heavy bleeding, and you're starting to feel...
Define heavy bleeding. That's kind of ambiguous for a lot of people.
Sure. The heavy bleeding is a little ambiguous. I would say an amount of bleeding that's concerning to the patient that, goodness, I'm losing quite a bit of blood here. If we were to try and quantify that, sometimes it's quantified in the number of, pads or tampons soaked in an hour or in a day, and there are different numbers used as sort of a threshold to take in when to seek immediate follow-up care. But I would say that definitely if you are bleeding enough that you are, let's just use the word frequently soaking a pad or a tampon, or if you are bleeding enough that you are starting to feel pale or lightheaded or short of breath, dizzy, or like you may faint when you stand up, that means that there is a decent chance that you are far enough down the road of blood loss that I would come to the emergency department. There are also conditions with abdominal pain and abdominal cramping that can indicate a pregnancy that's not in the uterus but is outside of the uterus in one of the fallopian tubes, something called an ectopic pregnancy or something out of place. That can be a life-threatening condition that needs prompt attention. It's also important to check aspects of the blood type when there's vaginal bleeding in pregnancy, as that can have implications we won't go into here, but for future pregnancies and carrying those to term. So trust your gut feeling. But if you're losing a lot of blood or you're having quite a bit of abdominal pain, come on into the emergency department. Of course, there are some patients who may be on blood thinner medicines or may have bleeding disorders, and you should have a much lower threshold for seeking care if that's the case.
Great advice. Okay, now what if I'm at home with my kids and I stepped away to go fold some laundry for a minute, came back, and my 2-year-old is underneath the kitchen sink and they're drinking some sort of cleaner? What do I do? First, I'm going to freak out. After I freaked out, then what do I do?
Well, I think that can be a very significant emergent situation. It may turn out to be not too emergent or urgent. It can be difficult. We have some resources in the community that are fantastic at sorting through all of that, and that's through poison control. And I think poison control would be an appropriate first line access on that if you can't find that number.
Just Google poison control, right? And it'll come up.
Not that we want to overuse 911, but 911 can transfer you to the Poison Control Center appropriately. And I would say that especially if your child seems to be acting like him or her happy, playful self, and you're wondering, like, did he or did she actually ingest anything here? Certainly if your child is upset, is confused, is lethargic, it seems to have noisy breathing, like they're struggling to breathe, blistering of the lips, anything like that, then I would seek emergent care.
Okay. And great advice. What do you
Well, there are certain situations too where they just need observation for a few hours, and kids care would be an excellent place for that because we have the ability to observe them, and if something goes south, then we can transfer appropriately. But a lot of times we can just watch them and then send them home.
Yeah, and sometimes that's just what you need is just some peace of mind. Some time has passed. Things are looking okay. Yeah.
And we work in concert, and I know that Kids Care does as well. We work in concert with the poison control centers. It's not uncommon that we have a child come to the emergency department because this child unfortunately got into a medicine cabinet or swallowed some cleaning supply. And both for keeping records and for assimilating statistics and tracking patterns, we often call the poison center and said, "Hey, are you aware of Jane Doe or John Doe here?" "Yes, I talked to Mom 20 minutes ago, and these are my concerns." And we'll say, "Well, now that we've seen them in person, these are the vital signs. This is my assessment. Let's come up with a plan together. Poison center, Kids Care, or emergency physician, and Mom and Dad, and we will come up with the right plan." And it's often a period of observation if the child's doing well.
That is great advice. Hopefully no one out there has to deal with that, but that is great advice. This is something that's happened a lot in our neighborhood and to my own children. They're riding their bike or scooter and they fall and they hit their head. What should you be watching for, and when should you seek help, and where?
Well, first of all, I'm just going to put a big plug in for always wear a helmet.
Very good.
That is, I think we all would agree, goes without saying.
Absolutely.
But certainly if your child is acting appropriately, or if you're concerned that there's a loss, even if there's a loss of consciousness, that is something that we can certainly see. We do have certain things that we can go through to determine whether the patient would need some observation, which is about 4 hours of observation from that time. And then if they develop symptoms during that time, we would send to the emergency department. But if they're seeming well, or if there's just a little bit of vomiting, that's certainly something that we could do at Kids Care, as we have the ability to observe and make sure that things are going appropriately.
Yeah.
One of the common questions I hear is, so you said 4 hours. Is there kind of like a window when you're in the clear if there's been no symptoms after a certain amount of time?
That's hard to give a black and white answer to that question. With head injury, first of all, I'd say good job, Mom and Dad, for getting your kid out on a bike and playing outside. Keep it up.
Put a helmet on.
This is normal. Kids are going to bonk their heads and they're going to hurt their arms and legs, and that's a sign of growing up in a healthy way. But absolutely, head injuries range, they can land anywhere on a spectrum. We know that head injuries can be fatal, and that's devastating. But then again, we all bump our heads hundreds of times in our lives, and then there's everything in between. There are mild concussions, there are serious concussions, there's bleeding and skull fractures that people end up surviving. Sometimes those bleeding episodes and skull fractures require intensive surgery. But I agree completely that if your child looks well, or if they've lost consciousness and now they look well, then a period of observation and definitely an in-person exam, looking for signs of skull fractures, looking for other injuries, spine injuries and so forth, that's important. If your child hits their head and you're struggling to wake them up, or they are having a seizure and they're not coming out of it, or they are vomiting nonstop, or again, your gut feeling is that something is wrong with my child's brain here, bring them to the emergency department quickly. because you may be right.
Yeah. And best case scenario, you get them checked out, everything's okay,
Yeah.
and you go home with some peace of mind.
Exactly.
Right?
Right.
Yeah. Okay, how about if, as a woman, I have a burning and pain associated with urination? Where should I go?
Connect Care sees women with bladder infections pretty routinely. Our criteria are that they really should have had one before in their life that's been properly tested, diagnosed,
By tested, you mean like giving a urine sample, they actually determine it's a urinary tract infection.
Correct. A recurrent urinary tract infection is often something that is recognizable after that first occurrence by the woman. And if they're adult, not pediatric, and they are female, not male, those are the criteria we're looking for. And then we can treat using appropriate antibiotics for an appropriate duration based upon the pattern of resistance here in the community, and hopefully get that taken care of without any further need to go into a facility.
And how long after you start antibiotic therapy for urinary tract infection can you expect to see an improvement in symptoms?
I think the textbook is going to say anytime antibiotics are utilized, it's about 3 days. But with bladder infections, I like to see it a lot quicker than that. I like to see a significant improvement within 1 to 2 days.
So if you're not seeing much improvement after that, then it would be good to see your doctor. Do you agree with that?
Yeah.
Okay.
Can I make a comment?
Yeah,
about
please.
Bladder infections, and remembering that burning with urination can be more than just a bladder infection.
Yes.
It can be other things. There can be chemical irritation, physical irritation of the anatomy that drains the bladder. There can be other kinds of infections besides urinary tract infections that lead to that burning with urination.
Like sexually transmitted infections.
Definitely.
And you don't want something like urinary tract infection to progress to a kidney infection. Some people interchange
Right.
the terms, and a kidney infection is much more serious. You don't want it to get to that point.
Much more serious. And so one thing to consider is if you are, and Wayne is absolutely right. There is some good research out there that shows that in a young, healthy woman who's having some burning with urination and maybe they're urinating more often, that you can treat them without any testing. If, however, you have diabetes, if you have a compromised immune system, if you're having fever or vomiting, if you're having pain in the flank areas, those can be signs of more complicated infection, and it would be important to get a sample of that urine and to check everything out, check out your vital signs and so forth.
Good advice.
Concur.
Yeah. Okay, we actually have a question from someone. Let's see, I don't have a name here, but they say, for those of us with kids that have a chronic illness or condition and something comes up after hours or weekends and the specialists are not available, would the ER still be appropriate with the knowledge that specialists would only be available at the hospital? From experience, I have found it difficult to gain access to the specialists even through the ER setting.
Great question. Yeah. I think that, we have a fantastic children's hospital in the Salt Lake Valley and Primary Children's Medical Center. And while I represent some of the other emergency departments, we are frequently working in concert with them. In the other ERs, we take care of bread and butter pediatric injuries and illnesses frequently. But if you have a child who is more complex or has some complex medical history, then we frequently will refer patients to Primary Children's. We will, and we don't have pediatric subspecialists at all of the hospitals. We do at Primary Children's. So hopefully your pediatrician will give you a good sense of whether you should only be going to Primary Children's. And if that's the case, definitely do it. If you come to us and if you need specialized pediatric care in an emergent setting, we can absolutely make that happen. And sometimes it's a transfer, sometimes we're coordinating care over the phone. So
maybe a good conversation to have with your pediatrician when you're not experiencing emergent situations and say, okay, what do I need to take them for and where should I go?
Yeah, especially in the setting of complex medical
Dr. Pool, do you have any input on that?
Yeah, so if I do actually, if it's unrelated to the child's underlying medical condition, say for example, they have a sore throat, Kids Care is an excellent resource.
Plus they have the pediatric specialty, so if it was indicative of something deeper.
Exactly, and we often will call the specialists and we can get a hold of whoever is on call for that specialty and we can speak with them if we have concerns. But if it's totally unrelated to their underlying condition, please, we're happy to see them.
Great place to go see you for that. Okay, great, good question. How about if a child puts their hand on a hot stove and gets burned? That probably happens more often than any of us would like to know, right?
We'd love to see them. We work very closely with the burn clinic, and most of the time we can do some essentially triage and some initial care and then work with the burn clinic to get them set up for an appointment the following day. Most of the time these don't need to be seen by the burn unit immediately, and we can take care of it now and then have them follow up in the burn unit with the burn clinic the following day.
Are there specific types of burns that you should just go straight to the ER for?
Yes, there are burns involving, significant burns involving the face, the eyes, inside of the mouth, chemical burns, inhalation injuries, somebody, there's some kind of explosion or barbecue, gas suddenly gets lit on fire. That can lead to, if you see any swelling or burning or singeing of hair around the face, I would definitely seek care in the emergency department. Significant burns that involve a lot of the body. If you have burned down, burns we stage in degrees of severity. If you're burning down and you're seeing, deep fat or muscle, those are burns that ought to have care immediately. Burns can be incredibly painful, and so even as was just stated, if your child has a burn and they need wound care and then maybe a follow-up visit the next day, sometimes they need a little help with pain control too, because there's not much that's more painful than a bad burn.
And that's not available at Kids Care. Is that correct?
No, that it's not.
Okay. So how about if a toddler gets a small toy stuck in their throat and is having difficulty breathing? It didn't completely obstruct their airway, but they're having difficulty breathing. What can you do at home, and then what should you do?
At home, you should, learning the Heimlich maneuver is a good thing. That would be if the toy were, you may get lucky and get the toy out, but if you cannot, and if your child is struggling to breathe, then it's important to get them to the emergency department quickly. Whether that means that you have the resources to immediately put them in the car with, hopefully an older sibling or another adult to drive them. If you need to call 911, that's an appropriate use of our
whatever's going to get them help faster, right?
Absolutely.
And I think it's great. All parents should learn basic CPR and the Heimlich maneuver. We can help in those instances. My son he was about 3 or 4, and he does not chew his food well. And so it doesn't matter how many times I've told him, you need to take small bites and chew well, right? He's just inhaling it. And one day in particular, it was a banana. And all of a sudden, he just, like the classic, I knew he was choking. And I was across the, my husband was in the kitchen, I was in the living room area, and I heard it. And I turned around, my husband's like, come right now, he's choking. And just those instincts kick in when you know what to do. And I just flipped him over and slapped him a few times, and it flew out. But if you haven't received that training, it may not be instinctual. And so it's good to have that, because there's lots of things you can do at home to help save your child's life in those instances. Okay, looks like we have another question. I love live questions. Okay. A couple of years ago, I had a kidney infection and went to the ER for intense pain and was told the ER is for life-threatening injuries and I should have waited. Should I have waited instead of going to the ER, or was that the right place?
Great question. It's going back to something we said a little earlier. I don't think patients and family members need to second guess their decisions too much about where they decide to seek care. You sort of assess your situation and you do what you think is right.
Well, she said she was having intense pain too, and it's not her job to determine what it is.
No,
right?
no, absolutely. It's hard to speak to the specifics of this case,
right.
But we evaluate patients with intense flank pain or kidney pain all the time, and it can be a number of things. occasionally it's something serious and life-threatening. Often it's something like a kidney stone that needs pain control, or you can have a muscle spasm, or you can get shingles in that area. There are a number of things that can cause it, including kidney infections. But if you are in intense pain and you go to the ER, that's a great choice. We'll gladly take care of you and evaluate this and hopefully make you more comfortable.
Yeah.
So I'm sorry for that experience. It's hard to know exactly what happened, but it sounds like she did the right thing.
I think it's safe to say a recurring theme I'm hearing here is that no resource is the wrong resource as long as you're seeking help, right?
And I've had this conversation at least once to shift with a mother usually, or a parent, where they say, oh, I feel embarrassed, I shouldn't have come in. And my thought is, I want you to come in. If you know your child better than anyone, and if you're concerned, that's why we are here. And I would much rather see a child where I can have a nice conversation and say everything is fine than have you at home with a child who is doing very poorly.
Yeah, and we see them sooner or later rather than sooner, and it's harder to fix the problem.
Absolutely.
Yeah.
It's a great combination, right? The parent knows their child. They know how their child typically acts. They know the environment they've come from. And then we know thousands of patients. And to combine that knowledge and experience of treating thousands with a parent who has that individual child in front of them and come up with a plan that is right for them it's a great way to do it.
I love that. Well, and you guys, everyone out there, these are the providers that we have working at Intermountain Healthcare. Everyone would be so lucky to meet you if they needed to seek help. Is there anything else that you guys think that people should know about where they should seek care for themselves or their family?
We'd be glad to see any patient with a concern through Connect Care, and if we can't accommodate it appropriately, then get it referred on to an appropriate level of care, whether that's the primary care provider, kids care, an emergency room, or whatever the case may be, including a 911 call on occasion.
Great.
And I would echo the same thing. We are happy to see them. The overwhelming majority of the time we can take care of the patients in kids care, but there are some times that it's beyond the scope of our practice and we'd need to send to the ED, but happy to start with kids care for sure.
Yeah.
Yeah, agreed. I think that I'll speak to Utah. I think that we have great medical care in Utah, and it's a priority to us not just to deliver the science in the way that we've been trained, but it's important to us to make a connection with people. It's important for them to feel like their situation was understood, that we take the time to address questions. And it's important to, at the same time that we're caring for an individual patient in front of us, we recognize as well that medical care is expensive. It's costing the nation, it's costing taxpayers, it's costing businesses and individuals a lot of money. And we understand the stewardship that demands, and we try to use resources appropriately, and we'll do our best to do the right thing for your child.
Well, thank you so much, each of you, for the work that you do to help people when they're vulnerable and impressionable. We appreciate everything that you do for our communities and for all the other providers out there. Thank you so much, everyone, for joining us. And, of course, you know where to find me if you have questions in the future on Instagram and Facebook. And you can also check us out on YouTube, Intermountain Moms. Thanks, everyone, and have a great day.